The explosion of Jew hate in Trudeau's Canada. Some highlights for our listeners. There has been a 670% increase in anti-Semitic incidents in the past year in Canada. Since last October 7th, there have been drive-by shootings at Jewish schools in Montreal and Toronto, a coordinated bomb threat targeting more than 100 Jewish institutions from Halifax to Victoria. Synagogues in British Columbia and Quebec have been firebombed. One synagogue in Toronto, Kehilat Sharei Torah, has been vandalized 7 times since April. Canada is broken. It is becoming a physically unsafe country for Jews. Montreal is now called North America's most dangerous city for Jews. Dr. Casey Babb is quoted saying, "Canada has now entered a dark and terrible period of systemic, normalized, and institutionalized Jew hatred." Strong and disheartening words by these two writers. And let me tell you, anti-Semitism has now seeped, no, poor choice of word, metastasized, a much better word, into medicine. The Jewish Medical Association of Ontario recently released data from a survey of medical practitioners showing a disturbing rise in anti-Semitism in medicine. My name is Bob Belfer, host of the American Jewish Medical Association podcast, The Jewish Voice of Health, and we welcome Dr. Barry Pakes, who teaches at the University of Toronto School of Public Health. He's on the Faculty of Medicine. And Barry, you organized the survey to take the pulse of the medical profession. So Barry, you checked the pulse. Do we need to start CPR?
I wouldn't say we need to start CPR. I think there's we've got a supraventricular tachycardia. Let's say it's not within normal range. It's well outside of normal range. But there are things we can do potentially to calm it down. I don't think it's life-threatening right now. If you want to go on that metaphor, I work in the emerge as well. But it's quite serious. And it's the real emphasis and in our findings, at least personally, what I found as well as an organization, it just confirms what we sensed and knew, and it points us in some directions to improvement, but also points to some ominous trends.
And we're going to talk about many of those highlights now, Barry. Again, your survey made not only national, but international headlines. The top takeaways from the press release that was shared by your people with us, and there were 18 of them. And I found only one positive one. Over 98% of Jewish doctors in Canada identified as Zionist. Okay? Many of them wore Jewish clothing. They had a physical appearance of being Jewish. Explain that, Barry, for us.
Those are some of the more interesting pieces of demographics. And one of the great things about this survey, actually, the most exciting thing, first of all, is that, there are approximately, we have no real numbers, firm numbers, but maybe 2,500 to 3,000 Jewish doctors in Canada. And the most incredible thing is that 1,000 of them answered this survey. So, I'm a researcher. I'm a public health specialist. I do surveys for a living. I have a PhD in ethics where I did that. To get doctors to answer a survey is just, unbelievable and unheard of. And another key piece here, we've reviewed and we will review some of the stats, but 500 of those 1,000 doctors who answered the survey actually filled in qualitative data about their experience, pages and pages. We've got 300 or 400 pages of data, of qualitative data. So that's first, the most interesting thing is we have just an incredible response, which on the one hand is great. On the other hand, tells us that anti-Semitism is a significant enough issue that people took, half an hour out of their day to do this. Those are our the high level piece is this is a really good, I wouldn't even say a sample as a researcher. This is almost, almost a mini focus group on each person individually. But almost everyone did identify as Zionist. And we looked at some numbers across the country. There was a particular province, I'm not going to say where it is, where out of the 2% that didn't identify as Zionist, now they might have been Zionist. I personally don't say I'm a Zionist. I'm a Jew, and Zionism is part and parcel of being Jewish, but many of them came from one place. So actually, that number across Canada, other than that one province, a smaller province, is actually well less than that. 99.5% identified as Zionism was part of their identity, certainly, which is really incredible and goes against a number of studies by many of them Jewish groups. One just released in Canada just the other week, showing that while a vast majority, almost everyone has an attachment to Israel, they said only 54% identify as Zionist, but that's because it's sort of a false distinction between what it means to be a Jew or attached to Israel or Zionism. But that was a great piece of data there, and they very strongly identified with a number of things. And how did people know? You mentioned another piece, dress Jewish, wearing Jewish things. The leading way that people knew that they were, or people thought that other people knew they were Jewish, is just knew they were Jewish. A large proportion of people taking holidays off, Jews in Canada are a little bit more traditional than those in the United States in terms of their observance, but, wearing them again, David, here and there, but, you're wearing scrubs, you're in your medical attire, you don't always know. It was just, they are known to be Jewish, which I think needs unpacking and is really interesting, but, another one of those interesting demographic findings before we get into the stuff about anti-Semitism.
Right. All right. Let's lead into that, Barry. As I said, that might have been the one and only positive result of the study. Let's talk about some of the other things. And let's start off right at the top, the magnitude of practitioners who faced anti-Semitism. A small number, medium number, large number, Barry?
So, a very large number, surprising, a very surprising number. So again, I'm someone who wears a kippah. I've always worn a kippah downtown Toronto. Now I'm one of the last, I may be the only last person in academic medicine there that wears a kippah. There, when I went to medical school, my medical school class was 160 people at the University of Toronto, the fourth biggest Jewish community in North America, 200,000 Jews, 22 men and 11 women in my class. Out of 164. So huge proportion. This year in first year class, there is one Jewish male. And we at the University of Toronto, we have a history, and my mother went to U of T as well, as both my parents are still practicing psychiatrists in their late 80s. And my mother went to University of Toronto as a Jewish female, back in the 40s and 50s, like in many schools in the US as well. They had quotas, and that quota was about 10% of the class. And so if you look at the U of T medical school class now with 260 students and one Jewish male, there's about 10 Jewish females, fine. But they apologized for that policy of quotas, but now it's well below it. So to your original question, the situation with anti-Semitism, if you look at our numbers, we looked at before October 7th and after. And when you look at before October 7th and in a variety of different settings, there was, in academic and university settings, it was around 50% had sort of infrequent, mild here and there. Whereas after October 7th, in particular, we're talking about hospitals or academic settings, 31% found it was either severe or intense. Which is, just really significant. So again, as someone who wore a kippah and experienced this or that all the time, for me to actually look at people who otherwise wouldn't identify, don't have a Jewish name, don't wear a kippah, aren't outwardly, Jewish, to see that all of those people as well experience such significant anti-Semitism and the stories we captured are just, really across the spectrum, things you would never think of. It is really quite severe, more severe than really even those of us who had put this together had thought.
And you say the stories, Barry. Just give us a few examples, maybe some startling examples of the types of anti-Semitism that some of your colleagues who responded to the survey brought up.
Most of these stories, we have hesitated to share them, and we haven't really shared them publicly. We've shared really just the stats for now because many of those stories are easily identifiable, but they range all the way from very inappropriate jokes in an OR to simply not want, an anesthetist not wanting to work with a surgeon, which, is a non-starter, right? So, there's the anti-Semitism that manifests as, patients not wanting to see Jewish doctors, as colleagues, physician colleagues, writing stuff, interacting in very negative ways, saying horrible things, not wanting to work with them, not taking referrals from them, not giving them referrals, whatever it might be. To potentially dangerous for patients with non, physicians who are anti-Semitic, and patients feeling that they're in danger, and then everybody else in the hospital environment, because this is not just in medicine, obviously. Whether it's orderlies, nurses, hospital CEOs, hospital EDI offices or university EDI offices. It ranges really across the spectrum of fairly mild and non-significant to some of the most severe stuff has been this horrific doxing that has happened to many of our colleagues. People have come out early on within the first couple months or even a couple of weeks. We're Zionist doctors and we're not ashamed to be Zionist doctors. And a number of people would sign that letter. I didn't sign that letter because I'm in a public position. I was chief medical officer in medical officer of health in York region, a medical officer of health with a population of 1.5 million people. Not something I could do at the time. I've resigned that position since now, not for anti-Semitism reasons, but one of the thinking behind it was to focus more on this issue, and really quite severe, which we can talk about a little bit, but I prefer to talk about the numbers until we've actually crunched that data and really created a sort of like a framework for thinking about what is anti-Semitism and how bad is it. The doxing is certainly some of the worst because it's out there online, even physical violence. And in Toronto, there has been physical violence against Jewish doctors long before October 7th. A thoracic surgeon, if I'm not mistaken, was walking by a protest beforehand and got in a physical altercation. And, some of that stuff that remains online is really quite profound, affecting, and lasting.
Wow. Barry, more than half of the respondents in talking about the manifestations of anti-Semitism talked about organizational policies or organizational communications. Are these emails, are these pieces of paper, what are they active anti-Semitism or just not recognizing anti-Semitism?
So, it really goes across the spectrum. And I can speak most from the Toronto experience. And again, not my personal experience because, in many ways I've been isolated from this. But vicarious experience through colleagues and looking through the data, which honestly, every time reading it over and even looking through it prior to this interview, it's jarring and difficult to read through what people are experiencing. When we're talking about offices and hospitals in many ways, right initially after October 7th, many hospitals, many governments, many other organizations put out sort of messaging, and understandably, people on the Palestinian side or the Israeli or Jewish side, whatever, would be like, this is not sufficiently recognizing the pain that we're experiencing. Fine. But where the problem is, and nobody can get it perfect sometimes, but sometimes, as I say, as a public health ethicist, one of our things we try to do is not to get it right, but to just not get it egregiously wrong. And some of those were egregiously wrong. Most of them in most hospitals institution were not, but there are certainly some leaders in EDI leaders, because most hospitals, most departments have that, who've been okay, and some who have been and were before October 7th, but just went really quite, I won't say ballistic because we can't use that term because ballistics are constantly flying, including just yesterday in this conflict, but went really out of line, and in particular. Overall, one of the big themes here is that the people that many Jewish doctors, including myself as a public health specialist working in the social justice realm, one of the biggest traumas here is that people in that realm who we work together with for vulnerable, marginalized populations and those folks, including those in EDI communities and in EDI leadership and training and all that, many of them just could not, either refuse to, but to be generous, could not see that what they were believing was happening was not really what was happening. And in fact, marginalizing, stigmatizing, and discriminating and participating in anti-Jewish hate. And I'm hoping ways that they didn't quite understand, but in many ways they did. So, that's the institutional piece. And to be honest, the University of Toronto, many other universities have dealt with it in not unreasonable ways. And some people are satisfied, some people are less satisfied. But, in many ways, the worst of it has been addressed, but in some places it has not.
And Barry, that has confounded me and many of our listeners. That we call it DEI down south. I know you call it EDI, same initials, but they represent every other marginalized population, and they're very quick to do it and to blast it out in front of you. Yet we heard crickets. Why is that?
That is a field of academic study, I think, and actually we're going to be writing a paper on it. Like, why is anti-Semitism so bad in medicine? And there have been umpteen PhDs written about Nazi medicine, right? And not to say this is identical, but I mean there are the same themes. Why is it so bad? First of all, why don't they recognize? Why is it crickets with respect to the Jewish community? And some of it is sort of understandable. I don't want to justify it at all, but many would see, I'm not going to speak for them, Jews are privileged. Jews are white passing, right? I've never identified as white, but actually when you look in Canada at our national body, so the Royal College of Physicians and Surgeons, or the College of Physicians and Surgeons, for specialties and for registration, that sort of thing, they will ask, like I'm sure you have many different identities of who you are. They've only recently started doing that. And of course, Jewish is not a category. In fact, in Canada, the last census that we did used to have Jewish as a category because we were one of the top 10 ethnicities. But because we're no longer the top 10 ethnicities, large waves of immigration, including recently, Jewish wasn't one of those boxes. So in fact, many Jews didn't see it, just selected white, didn't identify. And actually the Jewish population of Canada went down by half. Now it was corrected, of course, because we understand what happened, but that's what happens when you don't have a space to self-identify. And we've actually worked with and tried to work with some national bodies to get that in there. And in the past, we haven't, tried to put ourselves in there necessarily in that box. We maybe didn't feel it was necessary, but certainly, the leads in those DEI or EDI have shown us that we do need to put ourselves in there, and we're being discriminated against, anti-Jewish hate in all kinds of different ways, and you can be both, financially okay or not vulnerable in some ways, and yet the most vulnerable group in other ways. Meaning, and as you've cited, and we all know, anti-Jewish hate is the most common form of hate, the most number of hate incidents that are reported, certainly in Canada, probably in the US as well. And so you can be both of those things. And maybe it's just an inability to see that, have two things in your mind at the same time. There's a famous F. Scott Fitzgerald quote about that you can and you need to do that. And it's actually a sign of a truly intelligent mind. So, that's part of the reason. There are many other nefarious reasons. There are many true classic anti-Semitic reasons, but I'm trying to be generous.
I think the key word there, Barry, was intelligent, however you define that. Another highlight in the study, Barry, it did address if this anti-Semitism in medicine will affect the end user of the healthcare system, the patient, specifically the Jewish patient. What did your survey results show, Barry?
So the survey results showed that a very significant, I believe it was over half. I've got to go. There was so much data in here that I've got to look at it. But a very significant proportion, I think, well over half, felt that it could affect Jewish patients. I'm trying to be generous and put some caveats on the data. We asked Jewish doctors, and so we're talking mostly about the impact on them. But, what they thought could potentially happen with Jewish patients for sure. And I have to tell you that after October 7th, again, I mentioned my parents are both practicing physicians in their 80s. Both of them had health issues. Thank God they've been very well, but both of them had to be in hospitals. And I'm not ashamed to say in a public forum that, when we went into hospital and I found out the names of the doctors, I mean, they happen to be hospitals that I don't have lots of colleagues or friends in. And of course, as many people probably do, you look up the Twitter feeds of those doctors and the histories. Like, are they some of the purveyors of some of the worst? Are they not intelligent enough to put some of their hate out on Twitter? And I'm sure, and I know lots of Jewish patients are actually doing that. So you're able to find out the stuff you're able to find out. You're not able to find out, other potential information. And I think that is incredibly concerning to Jewish physicians. We haven't done a survey of Jewish patients, of course. That's would be much more difficult. But there's no question they were very, very concerned about Jewish patients, about Jewish doctors, and about Jewish medical learners, which I'm sure we'll get to.
Yeah, well, a nice segue. Barry, both you and I are in academia. We spend a lot of time with learners, medical students, residents, fellows. You already talked about the paucity of students, Jewish students coming in to medical school. What impact did the survey say learners, medical students, residents have felt due to the anti-Semitism? And again, I imagine it's much more difficult. You and I have 20, 30, 40 plus years of clinical practice, life experience. They're just starting into their field. They're holistic. They want to do good. They want to care for patients. And they're confronted by this anti-Semitism. What did the study show about that?
So the study showed that they are, extremely concerned, very concerned, somewhat concerned. Almost everybody was, and there was certainly, a large proportion that were extremely and very concerned about their futures. I'm not sure that they knew how concerned they needed to be, because as I'm also a program director of the residency program at University of Toronto in public health, and I know a little bit about admissions, and many of our faculty obviously do as well, and we know how, all admissions processes, certainly in Canada, try to be by the book and as process oriented and as objective as possible, and yet there's no way of getting around people's, if there is extreme anti-Jewish bias in the population who's going to be reviewing these applications, in the administration, in academia generally, it's going to impact who gets into medical school, who gets into residency, how they practice, where they practice, no question about it. And they are very concerned about it. And they have experienced things. We have, even though I said, there certainly are many females, Jewish females, not as many as when I went to medical school, but, I can just say at the University of Toronto, Jewish students, have had fairly challenging experiences. And one of the things we haven't talked about publicly, and I'm not going to really talk about here, is those specific experiences, because they are still in training, and they're going to be in training, let's be honest, if we're seasoned physicians, for the first 10, 15 years
Sure.
of your career until you get a little bit more comfortable. It's very hard to know what the future is going to look like, all the way from, I just don't think I can practice here, or as many doctors have done for the past 15 years, certainly colleagues of mine who are more religious Jewish physicians, just getting out of academia altogether, going into community practice, which is great too. But I love the academic practice, the always learning, innovating, and doing things. And it's just would be and is a tragedy that there's more folks like that moving out.
Absolutely. Barry, physician and nurse wellness is a huge thing in the States. I'm sure it is in Canada also. How has physician and nurse personal well-being, we'll use that term, been impacted by this anti-Semitism?
So very significant impacts on wellness, and I can scroll to the data here, but I can tell you just anecdotally, it was an overwhelming impact on personal well-being. It was some very significant, was about 20%, somewhat significant was another 20%, I'm rounding, and about a modest decrease in wellness, 41%. In personal well-being, professional well-being was somewhat similar. I think the key piece is only about 1% found that there was an improved wellness. 99% was not. Basically, in terms of personal well-being, 80% said there was either a very significant, or a modest decrease in their personal well-being, and somewhat a little bit less in their professional well-being. So, really, if we're concerned about wellness, I can't think of any wellness impacting thing like this, whether it's just their own perception of what's going around them or things directly impacting them, really having an impact on their day-to-day.
Barry, the health system in Canada, a little bit different than the United States. We always say we need Canada's health system. Canada always says we need US's health system. I just talked to my cousin who lives in Ottawa. His doctor is retiring, and it's going to be very hard for him to find another primary care physician, which leads me what I would consider probably the most startling aspect of the survey. Doctors were asked, will they continue practicing in the future? What did the survey find, Barry?
So, what we asked about was, what is the impact on your practice? What is the impact of all of this going to be? What are you thinking of doing? And we asked, one of the questions was, are you considering moving? Are you considering leaving? So strongly, or very strongly considering leaving, and 31% said that they were, right, which as someone who's had Aliyah on the radar for a really long time, and increasingly one of the reasons I'm staying, even though my children are probably leaving, many of their friends have already left, and certainly at my synagogue, very significant number of physicians have already moved to Israel. I think we need to stay here to combat this anti-Semitism for all those people who necessarily can't speak for themselves. But for me to see that number was 31%, I was like, whoa, who are these people? Where are they coming from? For me, at least, I think it was really how severe it really is. Another important question, I think, that we asked was, one of the things was, are you going to decrease your teaching role? And 46% said that they were going to decrease their teaching role or strongly considering it, or already had. 15% had already decreased their teaching roles. So, I'm a big fan of universal single payer healthcare. Maybe many of your listeners are not. It is incredible. 0% of your work ends up being on chasing people to get insurance. You are every doctor is a private doctor in Canada, and they just bill OHIP, and it works very well. What has happened over the past 25 years, but worse over the past 10, has just been a lack of investment in all levels, but including in physician training and just the numbers. And we've had 1 million people come to Canada and a population of 40 million in the past, year and over the past, just huge population increases. So, we are beyond the crisis stage in terms of not being able to get a family doctor. And in general, just, COVID, made things considerably worse and accelerated and made it more obvious, but we're in not a good place. Not because the system isn't great. There's much to improve in the system, but not because in principle it's not good, but there just aren't enough. And so, any number of physicians considering leaving, particularly those, we like to think that the Jewish physicians, and we know the Jewish physicians are not only those who are practicing great medicine and innovators, and we have a physician colleague of mine who just got appointed to the Order of Canada yesterday, which is sort of the highest honor that one can give. And there's no shortage of Jewish physicians in that area. Innovators, GLP-1 inhibitors, Ozempic, all that business, that's a Toronto doctor who developed some of that. So a Toronto Jewish doctor. So leaving, feeling uncomfortable would be horrible. Ultimately, there are 30,000 doctors in Ontario, and there's 100,000 in Canada. Is a couple thousand Jews leaving going to create even worse crisis among the acute crisis we have right now? I'm not entirely sure. I personally like to focus on the fact that it's not about the impact on the system, even on patients and on doctors. It is wrong. It is just wrong. Hate is wrong. Discrimination is wrong. Making people feel unwelcome in a world in which so much time is devoted to making people feel not hated, not discriminated against, welcomed, not just tolerated, that we as a society, we as a planet have decided that that anti-Jewish hatred is acceptable is just, it's unbelievable. And in that way, it very much is the same as Germany in the 30s. I don't like to compare things. I'm a student of history as well, but the shock of Jewish physicians, enlightened Jewish physicians who, for the most part, had nothing Jewish about them other than their grandparent, and to see what was going on then, and like, wait a minute, these were my friends. What is going on? It was very different place that it was coming from, and very hopefully a different result. I do not think we're on the precipice of that at all. But the idea that it is wrong is really what I like to emphasize, and we need to stop that, because as we always say as Jews, and nobody ever seems to listen, the Jews are the canary in the coal mine of various different societies, and in particular with the United States. It's a great place and been a beacon of light, not perfect in any way, sure, shape or form, but on the global stage. And we don't want to see the demise in any way, not only of as a country, as a body politic, but also of the society, because it makes a difference for Jews all over the world.
Let's talk about solutions, Barry. But before we do that, I don't like to play the blame game, but Barry, you and I play the blame game today. The environment of anti-Semitism has persisted due to failures of whom? Specific people, specific institutions.
I am not that comfortable playing the blame game because I don't have the answers. I think there are many levels of organizations who have not done the right thing that they needed to do as part of this, whether that means protecting individuals or making clear what's tolerated or is not tolerated. And again, I'm going to be very generous. Because I know how difficult it is as a leader. Ultimately, in Canada especially, Jews are a tiny little minority. Our numbers were fractioned in half, but we still know that there are about 300,000, 350,000 Jews in Canada. And just 10 years ago, that was in a population of 35 million people, so 1%. The population is now 41, 42 million. So we're a smaller and smaller fraction of the population. And so our politicians, if we just start with talking about them, it's hard for them to do the right thing when it will cost them politically. Some politicians do. It's hard for them to know what the right thing is, right? And in the Canadian media environment, and in many ways in the States as well, but it's a very different society, you have over there. I'm painting a general brush, everything south of the 49th parallel, but, there's a very different political dynamic. A problematic political dynamic, yes. most certainly. And in Canada, frankly, we've had very good relationships with the current, the Liberal Party for quite some time. And Justin Trudeau, I will not turn him into a villain necessarily. In fact, we've had a good relationships during COVID and that, but there is no question that the current government and the Prime Minister themselves, even though this is not a presidential system, so it's still a parliamentary democracy, they don't have as much power, but Canada has not been on Israel's side at the UN, has not stood up unequivocally right since day one to support Jews, forget about Israel, to support the Jews and protect the Jews. And that is a huge problem. And that has been at many levels of government. And I'm not going to point fingers as well. We have municipal, we have provincial has been, really quite supportive in many ways in principle, which makes us feel good. In practice, there's still a lot to do, but there's legislation in Ontario, at least, around anti-Semitism in institutions and organizations, in universities in particular. And one of the interesting things is when we had this press briefing with the JMAO at the provincial legislature, one of the things that we really are hoping for, one of the things that we hope to be able to accomplish is to take that bill that deals with or prohibits anti-Semitism and asks for reports on it in the universities and academic settings, to extend that to hospitals as well. And, because they are very separate. All of our hospitals, might be surprising for you to know, they are all private nonprofits. So they get funding from the government. So they're not, and doctors are not government employees in Canada. As I mentioned, we're all private practitioners. We go into hospitals, we bill the government. And so, what those institutions can do is do better. And some are trying. But the overall tenor, at the federal level, and we've had just in the past couple of days, some big news with some resignations and that might result in a new government that might be better on that kind of thing. But I think, and in the States, people are going to have very different opinions on what's going on, whether that's good for the Jews or bad for the Jews. But nothing is good for the Jews right now, other than the fact that, we've really seen, communities come together, identify. I actually, I've been teaching a Parsha Shir, a Torah Shir, a Torah class for members of the organization I used to be a part of. Every single week since October 7th, people who would have never done that before but wanted to connect. I'm not a rabbi or a teacher in any way, but wanting to do that. So there's the positive stuff. And the blame goes all around. It really is our society. It is the media. There's no question. The media, which I don't like to generalize everybody. As someone who was a medical officer of health during COVID, I spoke to the media all the time. And they were very, very attuned to the fact that this is not just about journalism, that what they say matters, and they want to get it right, and they want to be connected to the facts and the evidence because people's lives depend on it. But when it's Jewish lives and Jewish communities that depend on it, there just seems to be a real disconnection with the facts, and that's perhaps the most troubling thing. And that piece influences, and of course, with social media and algorithms that are out there, reinforces until you don't know what the truth is at all, and that's where we see ourselves.
Right, Barry, I think leaders, whether government leaders or academic university leaders, want data. And I think one amazing take-home of the survey was they now have data. It's not you, Barry, saying, oh, there's so much anti-Semitism in medicine. You have given them quantitative information, data, that now they can hopefully act on. Barry, I want to sort of finish up by talking about what's the answer to all this. And in my research, in talking to physicians both here and in Israel, I think we have an answer. And that answer comes from the country that some of our anti-Semitic medical colleagues hope is wiped off the planet. That country, Barry, is Israel. I and some of our listeners who have traveled to Israel since October 7th have firsthand experience. Dr. Seth Cohn, a Duke-based physician, traveled to Israel with the American Healthcare Professionals and Friends of Medicine. His experience mimics mine and many others. He published his experience on aish.com. We heard how Israeli hospital leaders, to reduce division, brought their healthcare teams together with the message that what happens outside these walls does not enter the hospital, and that there are no enemies in medicine. Barry, when we were in Israel, we witnessed Arabs, including heads of departments, and Jews working alongside each other in Israeli hospitals before, during, on October 7th, and after October 7th. This didn't change. All patients, Jews, Muslims, Christians, Druze, Bedouins, were treated with compassionate care. I think a lesson, Barry, not only for Canadian healthcare professionals, but also U.S. healthcare professionals, the Israeli healthcare system's ability to focus on its mission of providing compassionate care by Jewish, Muslim, Christian, Druze healthcare providers to Jewish, Muslim, Christian, and Druze patients, and its attempts to keep politics and anti-Semitism from entering the hospital, even in such dire circumstances that we live in today, serves as an important lesson in humanism. Barry, you get the last word.
I couldn't agree with you more. And they're able to do that in Israel, in a Jewish state where institutions, organizations at every level of government, in many ways, has their back, and that's the ethos. I mean, it's in the founding documents of the state of Israel. It isn't here in Canada. It's quasi in there in the United States, and I think we can all wish for a situation that you just described, and that's what we're definitely. You can't fix a problem unless you know it's there. That's what we tried to do with our data. There are many naysayers who are trying to say that our data isn't representative, but I cannot imagine a more robust survey. And as a researcher, I've done a lot of this. Can't imagine something more robust, just showing, if nothing else, it is a incredibly significant problem that has wide-ranging impact, and in particular in academic settings. And I really hope that we can use all of those settings and the institutions and the organizations to create the world that you described.
Thank you, Barry. Kudos to you and your colleagues at the Jewish Medical Association of Ontario for the work that you accomplished, for the dissemination of the data, and again, hopefully we will only hear positive things going forward. Thank you, Barry.
Thank you.